and today we are going to be assessing the abdomen. So first, we are going to identify our patient. The reason why we're going to identify our patient is to ensure that we are handling or assessing the right patient. So good morning, sir, or good day, sir. My name is Joseph from Southwestern University, Femoral, and I'm going to be your nurse responsible for today. Can I ask for your name and birthday?
April 29, 2004.
Okay po, sir. So I'm going to clarify your verification by checking for your ID bands. Okay, Mr. Larry. So in identifying your patient, you are going to be doing two patient identifiers, such as letting them state their name and their birthday, or if they are not able to be speaking their name and birthday, you can check their ID bands. Next is you're going to explain the purpose of abdominal examination and answer any question from your patient. So, sir, the purpose of assessing the abdomen is to ensure for any casual changes on your abdomen, or to do early detection and prevent it from worsening. So do you have any questions for you to be clarified?
That's it.
Thank you so much. So step 2 is to ensure that your patient is fully aware of what you as a nurse is going to be assessing him today. So this is to also promote patient cooperation. This is also to lessen patient anxiety throughout the assessment. Next is you are going to perform hand hygiene. So you are going to do the sanitation or the proper hand washing technique. So then we are going to perform hand hygiene. Next is we're going to help the patient undress if needed and provide a patient gown. You are going to undress your patient in this room. Only reveal the part you are going to assess, and the rest is you're going to cover for privacy. Next is you're going to assist your patient in a supine position and expose the abdomen and ensure privacy. So here, our patient is already in a supine position and is already undressed, revealing only the abdomen, and this is also to ensure privacy. So you are going to close the curtains, or if you are in a private room, always close the door to maintain privacy. So we are going to be assessing the abdomen. First is we're going to inspect the abdomen for skin color, contour, pulsation of the umbilicus, and other surface characteristics such as rashes, lesions, masses, and scars. So here we're going to assess. So okay, sir, I'm going to inspect your abdomen. So here, the reason why we're going to inspect for the abdomen for any changes or abnormalities is that we're going to make sure that, for example, for the skin, we're going to check for any redness, cyanosis, jaundice, pallor, or any other discoloration, such as the Collin sign, which Collin sign is the bluish discoloration. They are very blue discoloration that you can find upon inspection. So next, on the umbilicus and other surface characteristics, for example, in the umbilicus, you're going to check if there are any possible hernias or the umbilicus hernia. And then next is we are going to auscultate all 4 quadrants of the abdomen for bowel sounds by using the diaphragm of our stethoscope, and we use a systematic method. So here we're going to do an auscultation using our stethoscope. So I'm going to have my stethoscope. And set your stethoscope into a diaphragm, and then to auscultate all the 4 quadrants in a systematic manner. So you are going to start on the right upper quadrant, and then the lower quadrants, and here. Here on auscultation, you are going to auscultate for any bowel sounds such as hyperactive bowel sounds or hypoactive bowel sounds, or the normal sounds such as the borborygmi, and which is you're going to auscultate on your abdomen. After performing step 2, we are then going to proceed to step 3, which is again auscultate the abdomen for vascular sounds using the bell of your stethoscope. So I'm going to grab my stethoscope here and set your stethoscope from diaphragm to bell here. So then after that, we are going to auscultate the abdomen in a systematic manner. The reason why we are going to auscultate using the bell of our stethoscope is this is to check for any possible vascular sounds such as bruits, and to also observe for possible AAA, or also known as abdominal aortic aneurysm. Next is after auscultating using the bell of your stethoscope, we are then going to percuss the abdomen for tones. Follow the prescribed technique and arrangement. So here we are going to percuss the abdomen of our patient. We're going to use the same percussing assessment in a systematic manner. So this is how you're going to do it. The reason why you are going to percuss your patient's abdomen is to check for any tones such as tympanic, dull, flat, and resonance. The normal tone is the tympanic. Tympanic is a drum-like sound that can be specifically found in your stomach. Then we are going to perform step 5, which is palpate the abdomen lightly in all 4 quadrants using the palpation technique. If the patient complains of pain or discomfort in a particular area of the abdomen, palpate that area last. So here we're going to ask our patient, so sir, do you have any complaints in the abdomen? So for example, our patient has complaints on the right upper quadrant. We are going to palpate that area last and then start at the left upper quadrant. So I'm going to start palpating using light palpation technique. Here, since our patient does not have any complaints, we're going to start at the right upper quadrant. And then after light palpation, we are then going to do deep palpation technique on a systematic manner. After performing step 5, we are then going to proceed to step 6, which is palpate for the kidneys on each side of the abdomen, palpate the liver at the right costal area or the border, and then palpate for the spleen at the left costal border. This is how you are going to assess. So sir, I'm going to palpate and to do so. Here we are going to palpate the kidneys. And we're going to do at this other side. Then we are going to palpate the liver using the scooping method. You are going to scoop specifically at the rib cage part, like that. Next is at the spleen. You're going to palpate here. And done. Next is step 7. You are going to assess for rebound tenderness. Last, if the patient reports pain by pressing deeply and gently into the abdomen with the hand and fingers downward, and then withdrawing the hand. So sir, I'm going to do rebound tenderness. Please tell me if you are going to feel any pain when I press or when I let go. So, okay sir, I'm going to do rebound tenderness. Okay sir, how do you do?
I felt no pain.
Okay. We are going to perform step 8, which is to palpate and then auscultate the femoral pulses in the groin. So here we are going to auscultate for any bruise or any changes on, while auscultating on the pulses on the femoral part. Next is after procedure. One is we're going to replace the patient's gown and assist the patient in a comfortable position. So after doing an assessment, we are then going to assess your patient and replacing their gowns. So sir, I'm going to change your gowns. So you're going to assess your patient and changing their patient gowns into their clothes. Sir, almost done. And then set your patient on a comfortable position. Okay, sir, you want to lay down. Next is you're going to do hand hygiene or to perform hand washing. So I'm going to perform hand washing. And after doing hand washing or performing hand hygiene, we are then going to document the procedure. The purpose of documentation is to ensure that you have properly performed the assessment, or if you do not document the procedure, it never happened.